This is chapter 11, which is talking about the muscular system. We're going to look at several different muscles. Before we get started on the muscles, some of the vocabulary. We, with muscles, often talk about the insertion point or the origin point. And the difference between those is that the insertion is the movable end of the muscle. So when that muscle contracts, one end stays either completely still or almost completely still, and the other end is going to move. So the movable end will be the insertion. The fixed or immovable end, the one that's staying stationary, is the origin. Now, oftentimes people, as they start studying this, once again, will go, well, you look at the muscles, look at the origin, look at the insertion points. My recommendation is everything falls into place if you kind of study it in a certain order. So I would study the muscles, get familiar with the names of the muscles, where they're located, and then you can worry about what type of movement you're going to get and which is the insertion, which is the origin. Just personally to me, it doesn't make sense to me to memorize what is an insertion, what is the origin point. For this particular course, some of you may not really need to know that, but the bottom line is it's not going to help you if you can't tell me where the muscle is. If you can't tell me where the biceps femoris is, well, knowing the insertion and origin, how is that going to help you? The prime mover, which is also known as agonist, that's the principal, the main muscle that's causing the particular movement you're looking at. The synergist or fixator is going to be a muscle that helps to stabilize the bone where the origin is attached. So it's not causing the main movement, but remember, whenever you have a movement, that say you're moving your arm, so you've got the movement of the bone. Why? Because muscles are attached to it. There's going to be that main principal muscle, the prime mover, but then you're going to have other muscles surrounding that or helping to assist it. And you're always going to have an antagonist, which is opposing the movement. It's going opposite. It's helping to maintain position. It also helps to control so you don't have this sudden erratic type of movement. It keeps everything nice and smooth. You want a nice controlled movement. There's different ways that we name the muscles, and one thing that is often looked at is how are the fascicles organized? If the muscle fibers are all running in the same direction, typically all along the long axis of the muscle, we refer to that as parallel. If it's kind of a spindle shape where it's more narrow at the ends, it's fusiform. If the fascicles are in basically a circular shape, they're called circular. Those are often seen with sphincters. These are muscles, circular muscles, that when they relax, it increases the opening. When they contract, it closes it. Convergent is where you have the muscle fibers, there's multiple ones, they're covering a wide area, and then on one end, they're going to all come to a common attachment point. They all converge to a single point, kind of like a big old fan. And then pinnate, this is where the muscle fibers all kind of tend to blend into a tendon in the center of the muscle. It kind of looks feather-like, and you have different subcategories of these, either unipinnate, bipinnate, or multipinnate. And so sometimes, as you can see on this diagram here, that you have the different types of examples, like circular. Here's a multipinnate. Here's parallel, which is also fusiform because it's thicker in the middle but comes to a single point. Bipinnate, parallel over here, etc. These, sometimes in the name of the muscle, it will have the descriptive term as well. So for the rest of this chapter, what we are going to be looking at are the specific muscles. And so we're going to start with looking at the body, obviously anatomical position, looking at the anterior view of it, and just focusing on some of the major muscles. We'll look at them in a little bit more detail. A lot of these you may be familiar with, like the deltoid. The other thing is a lot of muscles, and you're thinking, oh my goodness, how am I going to learn the names of these? A lot of them will have in their name clues for you. The rectus femoris, well, where's the femur? You know to be looking in the thigh area. Those anatomical terms that you had to learn at the beginning, this is where they come back into play. Fibularis longus, well, look near the fibia. The tibialis anterior, that is, look at the tibia. You know to be, for both those, look in the lower leg. Where's the brachial region? Well, look up here in the arm. And so look at the name. I would say if you're asked to identify muscles and you go blank, well, look at the area of the body. And then there can be some other clues. We have a vastus lateralis and a vastus medialis. Well, what do your lateral and medial terms mean? Well, medial is more towards the center, and lateral is on the outside, away from the center line. So use those to help you. And then this is the posterior view, as you can see, with segments kind of broken away, so you can see deeper muscles. But as I said, we're going to go and look through several of these region by region, like the latissimus dorsi here, etc. So we're going to start at the head and work down. These are some of the muscles that are used. They're attached to the skin, so they're responsible for causing a lot of the facial expressions. You have the occipital frontalis, which is this large muscle here. You've got the ends that go over the skull. The frontalis belly up here is going to be in the frontal region, and the occipital belly back here in the occipital region. And then around the eyes, orbicularis oculi. So this is going to be responsible for, obviously, movements around the eye. Orbicularis oris, think mouth. So that's going to cause some of the mouth movements. Buccinator is along the cheek. That's going to help with also like smiling, etc. And like I said, a lot of these muscles right here are just below the skin. A lot of them are attached to the skin, so that when they do contract, you do get the movement of the skin. With the eyes, there are actually 6 muscles that are exterior muscles. They are on the outside of the eye. As you can see, kind of in the side diagram here, excuse me, you do have several of these called the rectus. There's 4 of them along here. The lateral and the medial, superior and inferior. That's going to help control the movements of the eye up and down, left and right. And then you have these 2 additional ones, inferior oblique and superior oblique, that also are, all these are helping to have very fine-tuned movements of the eye. If one of these eyes, typically either the lateral or the medial rectus, those are the ones that sometimes one of those muscles may be much stronger than the other, and so it tends to pull the eye. This is the pupil of the eye here. It would tend to pull the eye in one direction versus another. So if this is very strong, this one's weaker, it's going to be pulling the eye towards the medial aspect. And that's when an individual would have lazy eye. There is corrective surgery that can be done where they can actually go in and shorten one of the muscles to help pull the eye back in alignment. Does it cause any long-term damage by having that surgery? No, they've got it pretty well down pat. The earlier they can catch it, obviously, the better it is for the person. Then, if you have lazy eye, sometimes what happens is you tend to not use that eye as much, and so one thing is trying to encourage the use of the eye. They may initially put eye patches on the good eye to encourage use of the bad eye, but then they may actually end up doing surgery. And they can do this quite young. I actually had the surgery when I was about a year old. If you remember from the skeletal system, with the skull, the only movable bone is the mandible, your lower jaw. And so you're going to have several muscles involved. The masseter, notice the temporalis muscles right here in the temporal region, that are going to be helping to move the jaw. If you remove some of these muscles, like if you were to remove these muscles right here, the masseter one, then underneath you can see that you have the pterygoid muscle, the lateral and the medial, that they are also, when they contract, are going to be involved with helping to move this jaw, which you need to have a move, obviously, when you're chewing. There are a lot of muscles that are involved with helping to move the tongue. You need to move the tongue for certain speech patterns, for also to assist with swallowing. And a lot of these muscles are going to be attached to the hyoid bone that's down here. And so that's an attachment point for muscles. Some of them are also going to be attached down to the mandible. This is a cutaway view where this would be the mandible coming around here. So the lower part has the genioglossus muscle attached to the bottom of the tongue. But this way it allows movement kind of side to side if some of these muscles contract versus up and down to control that. Like I say, for speaking, for swallowing, helps with the chewing. Several different muscles of the neck. Excuse me. Once again, several of these are attached to that hyoid bone here. Just kind of FYI. Technically speaking, there's a correct way of swallowing, which I know sounds kind of strange. If you swallow, you really should see no facial movement. So if you were to look in the mirror when you swallow, you're involving the muscles in below the tongue and that are in the neck area. And so once again, like right here, the glenoid hyoid that we saw earlier, the glenoid glossus one, that it helps to involve these muscles here, so you would see movement here in the neck, but not like around the mouth. And then you can see part of this is peeled away so that you can see relative. A lot of people may be familiar, this muscle right in here. Here's the sternum. You have the sternocleidomastoid. And right here, cut away, obviously a lot of muscles in the neck. So it's like you can go one layer, remove, layer by layer through. But right in here, this area right here is the larynx, which contains the vocal cords. And then you move down here to the trachea. Behind this would be your esophagus. So the trachea is going to the lungs, and behind it is the esophagus, bringing food items to the stomach. And then right here is your thyroid gland. That's right in front of the trachea. So when we look at some of these muscles of the neck, the sternocleidomastoid goes from down here up. This the lateral or side view of it. That's one of the major muscles of the neck. Then on the back side of the neck, you've got the trapezius, which on the side you just see this portion of it, but then it extends around like this from the back view. So here's your vertebral column. And then here you see some of the deeper muscles from the neck, where you've removed some of the superficial layers. Do you have to know all these? No, you don't. But it's just giving you a reference point. So just trying to look once again a little bit more closely in here. Probably one of the major ones that we usually have you learn is that sternocleidomastoid. And the name here also helps to tell you, once again, where is it? What is it attached to? Sternum is going to tell you it's attached to the sternum. And so use those names to help you. In the back underneath the trapezius, you have the rhomboides, the minor, which is smaller muscle, and then the rhomboides major, which is larger. So that's going to give you some clues too, like, oh, which one of these? I know it's the rhomboides, which one's which? Smaller is minor, major is going to be larger. On the back, excuse me, once again, looking more deeper, removing those layers, and look at how long some of these muscles are as they extend all the way from the lower part. They attach the lower part of the vertebral column and are extending up all the way through your lumbar, through the thoracic area, all the way up to the cervical area. So some of these are quite long. And you can see how they are attached relative to the vertebrae. So here's the vertebrae and here's the vertebrae with the transverse processes of them and the spinous process sticking out here. But you can see how oftentimes the muscle kind of weave through those deeper muscles. A lot of the muscles of the abdomen. So if we're looking, it's kind of at an angle, kind of a cross between an anterior view and a lateral view. Here's the pectoralis major. On the back, kind of going, here's the latissimus dorsi, which when we look at the back view, we'll see that again. These muscles right here that kind of come out, this relative fascia right here, this is the anterior serratus. Now on the front side, the anterior view, you've got your external obliques. You're going to have the rectus abdominis. There's a sheath that kind of connective membrane that's over top of it. Now, if you look at this cross section right here, and this is where sometimes people get a little bit confused with stuff. You have your rectus abdominis. You have next. If you go down one layer, you're going to have the transverse abdominis. Look at the way that the fibers are running relative to each other. The rectus abdominis, those fibers are running essentially up and down. They're running inferior superior direction. So they're going up and down. But the transverse abdominis, those fibers now, which is one layer deeper, so you would have to remove the rectus abdominis to see it, those fibers now are running sideways. And then people will often go, okay, let me figure out the external obliques and the internal obliques. Look once again at the direction of the fibers. The external obliques on the front are lower and they're moving upwards towards the side, but in an upward angled. And they're on the most superficial layer. One layer beneath that is going to be your internal obliques. And look at this, they're running in the opposite way. On the front, they're higher up, they're moving downwards towards the side. The externals are moving upwards towards the side. Plus just the fact, external is going to be on the surface, internal's one layer deeper than that. So look at the direction of these fibers. In terms of why do the fibers run in different directions depending on which layer you're in, that allows for a multitude of different types of movements and more control and stronger because it can deal with forces coming in different directions. Now, if we look at the posterior abdominal muscles, once again, this is the ilium. This is part of your pelvic bones here, and you can see how the muscles attach to it, and some of them actually feed through some of the foramens down and attach them to the femur. Once again, allowing different ranges of motion here. The diaphragm. Well, the diaphragm is that muscle. It's going to separate your thoracic cavity from your abdominal cavity. It's assisting with breathing. It has to have openings to allow for things from the thoracic cavity to pass down through the abdominal cavity. There has to be connections. So in this diagram, they are showing, yes, this is all of the diaphragm. And if it's a cross section, so if you're looking at it, here is the front. Here's the sternum, showing your ribs over here. Here is the vertebrae. So your spinal column is going to be here. The diaphragm, if you look at it, like I say, you have to have openings. Your esophagus has to be able to pass through the diaphragm to get to the stomach, because the stomach is below the diaphragm. It has to be able to bring the food there. So this is the opening that allows for that esophagus to pass through. A hiatus is usually an opening. Now, in terms of the blood supply, you have the aorta. Your abdominal aorta, descending aorta. Remember, the aorta, when it comes out of the heart, it has that arch. So initially it's moving up, and then it arches and moves down. You have the descending aorta, and then once it passes through the diaphragm, it becomes the abdominal aorta. You've got to get blood supply to the lower part of the body, anything below the diaphragm. So this is the opening, the aortic hiatus, that allows that aorta to pass through. Now over here is another hiatus that allows for the inferior vena cava to bring the blood supply back up to the heart and lungs. The intercostal muscles, these are going to be assisting with breathing. It helps to move the ribs so that every time you inhale and exhale, what's helping to assist for this is the ribs moving, and when they move, it's changing the volume of the thoracic cavity, so that if you increase the volume, it's inverse to pressure. And we'll cover this in the respiratory system, but just know that when you inhale, you've got muscles contracting that are going to be moving the ribs, so therefore the whole thoracic cage moves up. You increase volume, which decreases pressure. Pressure wants to go from high to low, just like how liquids want to go from high concentration to low concentration, and it allows for you to inhale and have the air, atmospheric air, flow into the lungs. And then when those muscles relax, it's going to actually decrease the volume of the thoracic cavity, and allows you to exhale. Remember, coastal refers to ribs. So, excuse me, once again, attached to ribs, you do have your pectoralis minor that is below the pectoralis major, so that's going to be the first layer. Then you move down to the pectoralis minor. As you can see, it's attached to the individual ribs. And then underneath that, you've got your external intercostals. Beneath that, you've got your internal intercostals. So you can distinguish the two by the layering, but also, once again, look at the direction of the fascicles, of the fibers. And then beneath the internal intercostals, you've got the innermost intercostal ones here. So these are going to be playing a role with, since they are literally right here between the ribs, etc., are going to be playing a role, and they're behind it, in moving this, the whole rib cage kind of up and out. And once again, like I said, that allows you to inhale and exhale. So once again, use the names of the muscles to help you locate them. So if I were to be asking, okay, where are the internal intercostals? Think costal rib. So immediately start looking near the rib. Don't be looking at your foot, because you're way off then. If I ask you to identify the biceps brachia, you better be looking at the arm. Once again, don't be looking at your foot. So use the names to help you identify them. In terms of muscles of the pelvic floor, as we continue to move down, once again, a lot of the muscles, remember, part of the muscle function is to help support the internal organs. And so, and here you can see several of the muscles that are helping to support all of the abdominal and pelvic organs that are above them. In terms of, this is the front, here's the back, here would be the end of the vertebral column, here's the sacrum right here. And so on the floor of the pelvis, you do have these two muscles come together to form the levator ani. You have, in terms of reference points, here's the rectal canal, opens up the anus. Over here is the urethral canal, so the urethra is going to be passing right through here. And then for females, this is the vaginal canal. Some of those abdominal muscles, especially for women as they get older, and especially if they have had either multiple pregnancies or if in their pregnancies they have had very large newborns, those muscles can often weaken, and so that can cause some additional problems and issues later in life for them. In terms of the muscles of the perineum, the male versus the female, as you can see here, once again, some of the muscles that are helping with the in the perineal area, the pelvic floor, the external, like the external anal sphincter. Here's the urethra for females, the vagina. You have the supporting muscles around, and in males, similar, once again, muscles, similar arrangement, the anus, and then through here, the penis that has the urethra in it. The pectoral girdle, the shoulder joint. Some of them, there's a lot of muscles there, and this is showing some of them that are helping to stabilize that. Remember, with joints, there's a give and take. The more flexibility you have at a joint to allow for greater movement, like what you see with the shoulder, the thing you're going to give up with that is stability. So it's kind of like you either have flexibility or you have stability. And for the pectoral girdle, the shoulder joint, you have a very huge, wide range of motion, but it's not the most stable joint. If any of you, say, play baseball, you're very familiar with that. How many times do you hear somebody, like a pitcher, and having issues with their throwing arm and wearing out the joint in terms of throwing it out, their shoulder out, etc. So how do you stabilize it? Well, one thing is to have more muscles, remember, help to stabilize the joint. So you're going to see there's a lot of muscles around the pectoral girdle. So this is showing here the deltoid. Now it's removed part of it, so you can see some of the muscles underneath. And this is showing one of the processes on the scapula, which processes, remember, they're prominent projections off of the bone. And it's often where muscles attach, and that's actually what we see. So we have several of these muscles that come up and attach here on the scapula. Your pectoralis minor that we just saw a little bit ago, one end is attached to the ribs, and then it comes up and attaches to that choroid process on the front of the scapula. Here's the scapula that extends back around on the back side now. Here's your serraceous anterior, all those move up. The sternum is over here, as you can see. If you look at this viewpoint, here's your vertebral column on the back. On the most superficial layer, you've got your trapezius once again. So yes, that's a muscle that goes up to the neck, but it's also helping to stabilize the other end where it's attached to the scapula. It's going to help stabilize that shoulder joint. Once again, here's your deltoid. You've got your rhomboid minor and your rhomboid major. Major is going to be larger. See how it's thicker here. Muscles that are going to be involved with helping to move the humerus, moving that upper arm. Once you've got, again, you've got your pectoralis major here. The deltoid, obviously, at the top of the shoulder is going to help move it. Your latissimus dorsi goes down the back. It kind of connects underneath the trapezius here. So it's down here on the lower back, but it's attached over, and that's going to be involved with helping to move the arm as well. When you look at a deeper view, so you remove those superficial muscles, once again, the deltoid, so you're going to see that there's some muscles can have multiple functions in terms of the type of movement. Are they helping to move the neck? Are they helping to move the upper arm? So they can have multiple purposes there. So once again, this is similar to the one that we saw earlier with the serratus anterior, the deltoid that's been cut away, the teres major back in here. If we look, here is the triceps brachia, triceps meaning it has 3 heads. You're seeing just a portion of the latissimus dorsi here. Here's the teres major, infraspinatus, a little bit of the deltoid there. Supraspinatus is here. The teres minor is smaller right here. Once again, teres minor is smaller than the teres major. And then now if we look at the anterior view, we have the biceps brachia. The biceps brachia, you've got the muscle here, you've got 2 heads here, 2 connection points. The brachialis, which is beneath the biceps brachia. And one thing I try to recommend to students, I know that common layman's terms just refers to this muscle is the biceps and you've got your triceps over here. I encourage you to please use the full name because there is also a biceps femoris, and I want to know that you can distinguish between those 2 muscles. So for me on a test, if you just say biceps, you're only getting half credit because I need to know that you know the difference between the different muscles. Triceps, like I said, has 3 heads, so 1, 2, 3. Now the forearm. Now we're getting into more and more muscles. So here's the bottom of the biceps brachia right here. We saw the little bit of the brachialis before. Here's the brachiradialis. So now that's going to be further down. The pronator teres, the flexor carpi radialis. And part of learning these muscles, I always say it helps if everything or most pictures is shown in anatomical position, but pick a reference point and then just move over from there. So you kind of go, okay, well, I know that this is the brachioradialis, the one coming in at the angle is the pronator teres, right beneath that, and then 2 over, and just find your landmark, if you will, and then move right and left from there. So now if we look, once again, the forearm, this is the dorsal view. Here you've got the triceps brachia, brachioradialis here. And once again, just pick your landmark and move around from there. A lot of these names are going to be, the muscles are named by the type of movement. Do you have extension? Do you have flexion? And that's where a lot of the names come from. So now if we're looking at some of the deeper muscles, this is where you find a lot of the flexors, the flexor polaris longus. Polaris refers to the thumb. You've got the flexor digitorum profundus, so that's time at the digits or the remaining 4 fingers. Over here, abductor polaris longus, once again, talking about the movement, and you're talking about the thumb, the thumb versus extension. These are 2 different types of movement. And then when we look at the hand itself, for fine-tuning movements of the fingers and the thumbs, you can see that. And you'll notice too, there are a lot of ligaments through here. When you are learning the muscles, focus on just, more the major muscles. Like, well, you have to know the names of all the muscles in the hand. No, you will not. Excuse me. Moving on down now to the legs, the muscles of the hip and the thigh. Excuse me. You'll notice along here, probably one of the easier landmarks is to look for the sartorius muscle. That's often referred to as the Taylor's muscle. Allows you to sit cross-legged, and it goes across at this angle. And so a lot of times people will use this as a landmark then for learning the muscle. So that's the sartorius. Over on the lateral sides, on the outside, this long muscle that will extend from the hip all the way down. Now the bottom portion of it has this ligament here, but it's known as the tensor fasciae latae. This large superficial muscle that's just below the sartorius right here, this is the rectus femoris. So femoris puts you in the right spot. So that's pretty much almost, it's not quite dead center, but it's pretty much in the middle. If you go to the lateral side, you see the vastus lateralis. If you go to the medial side, you have the vastus medialis. Above the sartorius, on the innermost side is your gracilis, and then you've got your kind of tucked underneath here, the adductor magnus and adductor longus and pectinus. So once again, use this as sartorius muscle as your landmark. It's usually one of the easiest things. Now, if we start to look at the deeper muscles, now you can see the adductor magnus, adductor longus, adductor brevis. So obviously these three are all adductors. Here's the gracilis on the outermost side. Now you've got the, from the posterior view, the semimembranosus, semitendinosus. Once again, usually kind of go gracilis, membranosus, tendinosus. And then you've got your here's your biceps femoris that I was talking about earlier. Use the full name. This is not, don't call it the biceps, and certainly don't call it the biceps brachia. Use the full name, biceps femoris. And up here it's showing you've got your gluteus maximus that they have cut. It would extend over all of this. Beneath that is your gluteus medius, and below that one is your gluteus minimus. So there's three different layers of your glutes, if you will. When we look at the lower leg, the superficial muscles now, excuse me, you have your tibialis anterior. That's going to be right next to the tibia. Remember in the leg, the tibia is the thicker bone because it's carrying all the weight. The fibula is diameter is much smaller because it's used a lot for muscle attachment points. So here's your fibularis longus, your extensor digitorum longus right here between these two. So it's in the middle. So you usually find the tibialis anterior. It's one of the major muscles on the from an anterior viewpoint. If you look at the back side, the gastrocnemius is a large muscle that's on the back of your calf. Beneath that is going to be the solaris muscle. Now, the gastrocnemius, you've got these two heads. It comes down, is quite the large muscle here. And then down here you've got the tendon where it attaches to the calcaneus, your heel bone. That's your calcaneus tendon, also known commonly as your Achilles tendon. Popliteus, the name of that should help tell you that that's going to be passing over the back of the knee. And then The solaris, now they've cut that, and underneath you got tibialis posterior. These are all deeper. So here are your superficial muscles, here are your deeper muscles. And then this is showing some of the muscles that extend with the down into the foot that allow for some movement of the toes, etc. Do you have to know the names of all these? No, but it's showing you relative spacing of it to other muscles, etc. So it gives you an idea what it looks like. You've got superficial muscles right here on top, and you can go layer by layer till you get to the deep view of them. Similar to the bones, one of the things that I find helping to learn the muscles is to obtain copies, whether it is the full body or just say focusing on the arm or the leg or the thoracic area, etc. Find pictures, whether you take them off of study resources that I supply, or whether you just go to Google Images, or if you have an anatomy coloring book, it doesn't matter. Just find something. If you go to Google Images, there's a lot where you have blank, you can get unlabeled pictures. And then just get a plastic sleeve, like I said, just what I recommended with learning the bones of the skeletal system. Print off these diagrams, these pictures, put it in a plastic sleeve, and then use an erasable marker and label. And then erase and label again. That way you're not printing off a bunch of copies. You only have to print off once. And you can keep all of these pictures in a binder for study purposes. But that repetition will help you. So good luck.